right. All right. Hey, Corey, how are you doing?
Good. Thank you so much for having me on today.
Oh my gosh, thanks for coming on. You've got a baby in one hand, and it's pretty impressive. That will be a first for my podcast.
Oh yeah, all right. Woo, yes, all right. Making waves, paving new
Yeah.
paths. Yeah.
Yeah, so I'm really excited to have you on today. I know with my listeners, at least, PCOS tends to be a topic that really gains a lot of interest. And I think part of that is that the majority of the people that follow me on Instagram are female. And it is something that is incredibly prevalent today, as you know, because this is your expertise.
Yes, absolutely. Yeah. So PCOS is super common and it's a lot more common than we might think. It's about 10 to 15% of women have PCOS, polycystic ovary or ovarian syndrome. And it is also the leading cause of infertility, which is another topic that we can dive into if we want to.
Yeah, absolutely. And what are some of the main symptoms that you see as being some big red flags for people that have PCOS?
Yeah, so there's a few things to consider. One of them is irregular periods. So, a kind of a classically defined regular period would be anywhere between roughly 21 to 35 days. So, if you're not having a period at all, or if your period's coming like every 21 and then, 37 and then 45 days, or if you're bleeding just like all the time, nonstop, spotting here, spotting there, maybe that's a period over here. There's no clear pattern for irregular periods in PCOS. So any of those could fit the PCOS description of an irregular period. So that's a big tip off. Now there are other causes of that, but that's a very, very classic PCOS symptom. Another one is symptoms of elevated androgens, which are our male sex hormones. And women have those hormones like testosterone, just in the same way men have estrogen. We just typically make them in smaller amounts. So when they're elevated, a lot of times in women with PCOS, it can cause things like facial and body hair growth, hair loss on the head, acne, and a big difficulty with weight loss. So that's something to look out for. And then if you go to the doctors and get some testing done, you can maybe see those elevations in those androgens like testosterone or DHEAS. And then also, if you get a pelvic ultrasound, you might have what are called polycystic ovaries. So basically, these little tiny, they're really not cysts, not the same type that can rupture and cause pain. We hear women sometimes say, "Oh, I had a grapefruit sized cyst and it burst and it was horrible." That's not, pain is not a symptom of PCOS, which is a big misunderstanding in a lot of the
Mm.
community and people diagnosed. What those little cysts are really just underdeveloped immature follicles, and those follicles hold potentially an egg to be released for ovulation. So in PCOS, they're all kind of competing and nobody's winning. That's how I describe it.
Hmm.
So that's to say, though, PCOS is very complex. So you don't have to have all of those symptoms in order to have PCOS. It can kind of cherry pick and show up very differently in different women.
Okay. Excellent.
Mhm.
That was such a great overview for people because I think it can be really confusing for people to kind of parse through,
Oh yeah.
first self-diagnosis is usually never a good idea because, you're kind of going down a rabbit hole and then you're, Googling things and getting all types of advice on the net, which is not ideal.
So true. Yes. Very.
Um,
Dr.
so
Google.
when it comes to fertility, why is it that women with PCOS have more issues with fertility? I mean, it makes sense based on what you said that if you're having irregular periods, I know you're a big advocate for tracking your cycle and, figuring out when you're ovulating, like basal body temperature tracking. So that's probably part of it, right? Is you don't necessarily know when you would be ovulating. Are you ovulating? But what are some of the main reasons why it's so challenging for someone with PCOS to get pregnant?
Good question. So the reason why PCOS is the leading cause of infertility is because women with PCOS ovulate either irregularly or not at all.
Mm,
So ovulation is, we all think of our period as kind of, the star of the show when we're talking about our cycle, but really what precedes a period is called ovulation. And ovulation is essential in order to get pregnant. If you are not ovulating, there is a 0% chance that you can get pregnant outside of working with a reproductive endocrinologist or something like the IVF. So you have to have that happening. And if you're not ovulating, you're not going to get a regular period. So a big problem with PCOS too is that we are the number one top, recommendation as far as treatment goes is birth control. So oftentimes and I say we because I have PCOS and that's why I got into this, but we are given birth control at a really young age, 15, 16, even younger sometimes. And when we are in our, say, 20s or 30s and we're ready to start our family, we come off birth control and then boom, we're hit with all of these PCOS symptoms that the birth control pill or whatever form had been kind of keeping under wraps. So we realize that we're not actually ovulating regularly. And so if you think about, say, a woman without PCOS who ovulates every month, she has that, 28-day, whatever, 30-day cycle. She has theoretically, 12 chances of pregnancy per year. And if a woman with PCOS ovulates twice in the year, she's only got 2 chances. And every cycle, even if you time intercourse perfectly, the average woman only has a 25% chance of pregnancy during that particular cycle. So you can see that, the big difference between that 2 versus 12 chances. And so that's really the number one reason why it's so difficult. And then also once we do get pregnant, we are at a slightly higher risk for miscarriage, and we're also at a higher risk for certain pregnancy complications like gestational diabetes and preeclampsia.
Okay.
Cause all kinds of stuff, but
Sure.
yeah. Mm-hmm.
Yeah, that makes a lot of sense. Now, in terms of, someone's pregnancy journey with PCOS, a few questions that I think should be answered, just because I feel like as women, we're not typically very well educated about this
Yeah.
stuff in general. And,
Right.
can you still get a period and not ovulate? That would be the first question.
Good question. So no, it wouldn't be a true period, but you can bleed and it might look like a period. Usually it's has different characteristics. Like someone will bleed for 2 weeks.
Okay.
And that's a big tip off that that's not a normal period. Or maybe they just spot kind of and it's super, super light. It's not that like red flow that we're used to when we get a real period. So you can bleed, and that's called anovulatory bleeding. We see that a lot in PCOS, which is why I am a big advocate for tracking your cycle, because if you track your cycle, you will know, yes, that was an ovulatory period, or, ooh, yeah, no, I bled, but it didn't come after ovulation and it wasn't a real period.
Okay.
So in order to get a real period, you have to ovulate, but you can still bleed without ovulating. I know that's confusing, but that's the best way to describe that.
And well, you need to ovulate to get pregnant, right? So that is a very big point to make and kind of hit home that someone listening might say like, well, I bleed once a month, so I should be fine. But if you're not ovulating, as Corey's alluding to, then something to maybe look into. Is there anything that you suggest, like specific apps or devices that you like for basal body temperature tracking?
Yeah. So cycle tracking is a whole big world, and we can cover, super, super basics, but you can track your, cervical mucus. You can track your, you can use what are called ovulation predictor kits, which can help kind of predict ovulation coming on. But the only way to confirm ovulation is happening outside of a doctor's office getting an ultrasound all the time is what's called a BBT, basal body temperature thermometer. And what that does is it tracks your basal body temperature, your temperature basically. And you track it every day, and your body temperature actually rises after ovulation. And that's because after ovulation, you're producing progesterone. And progesterone is what is essential for a pregnancy to be maintained. And it heats the body up really subtly, but it heats it up enough to show on these really, really sensitive thermometers. So that's what I would recommend. And my top recommendation of that device, of all those devices, is called Temp Drop. It's one word, TEMPDROP. And I have a highlight on Temp Drop on my Instagram page with kind of all the info and all the goodies there. But that one is really cool because traditional BBT thermometers, you have to wake up at the same time every day and take your temperature. So if you're somebody who wants to sleep in on a Saturday, or you oversleep, or something like that, which applies to a lot of us, or you have different varying schedule, it's a tough thing to do and stay consistent with. So the cool part about Temp Drop is it is a wearable BBT. So you put it on at night and you take it off in the morning anytime, whatever time, and it tracks your temperature all night long and it spits out an average. And that's your BBT temp for the day. So it's
Hmm.
very convenient. And I find much higher rates of compliance, which means more success when it comes to tracking and pregnancy or avoiding pregnancy, than the traditional BBT. So I love that one. And that's the one that I have been recommending for years.
Yeah, I gave up pretty quickly on the manual
Uh-huh.
temperature taking. I remember the temperature I had, it would make even like a beeping sound, and I'd be, laying next to my boyfriend and it'd be beeping in the morning. I'm like, this is not realistic. I
Oh,
lasted probably a
yeah,
week.
yeah. Right. I
Yeah.
know. Yeah, Temp Drop, no beeping. No
Okay. All right,
beeping.
good to know.
Yeah.
You mentioned the birth control point. I did want to kind of
Yeah.
come back to that. I think
Sure.
this is something you probably see a lot of, is that masking of the symptoms.
Mhm.
Would you say, and I don't know if you can answer this, but would you say that the longer someone's on birth control, the more challenging it will be for them to maybe get pregnant after, dealing with PCOS and kind of having that Band-Aid symptom? Or would you say it really depends on the person? Have you seen any research on that at all?
So yes and no. Doc, research will tell us again and again that no, it has no effect. I will say though, some forms, like I just saw some research on the Depo-Provera shot, and it can prevent or make ovulation really funky for up to like 2 years after stopping it.
Mm.
So some forms, yes, but from what I know of the pill, the IUD, I don't know much on that one. I'm going to say it's probably similar to the pill in that no, like if you're on it a really long time, it shouldn't have any impact on your ability to get pregnant. But I will say though, kind of from the lifestyle point of view, I would say yes, because we're not in tune with our hormones, obviously, when we're on hormonal birth control. And that's because our natural hormones are essentially kind of put to sleep, and they are replaced by synthetic forms. So we start to learn different pieces of our body that and our hormones that we weren't really in tune with before, and that might be confusing. It might be we might be moodier or have more acne, or so that doesn't really affect fertility. But I would say just as a whole, kind of reintroducing ourselves to ourselves, post coming off of all those synthetic hormones, may pose a challenge when we're talking about tracking our cycles and understanding ovulation. And, it's kind of like a new language. So research versus lifestyle, yes and no, but that's a really good question. And I'm sure a lot of folks wonder that.
Yeah, I'm very curious to see if there will be much research done on the impacts of IUDs in particular, because I've worked with some clients and have some anecdotal reports of people experiencing, just kind of unknown symptoms with otherwise healthy individuals, and that being kind of like the last factor, and maybe them having them removed and feeling better. So
Right.
I'm very curious and would love to see if anything in the future comes out with that, because it's a great option, right? For people that, especially the
Right.
non-hormonal ones, of people
Mhm.
looking for options for ways to, practice some sort of birth control without having, the hormonal aspect of it.
Totally. And they've become a lot more popular and common. Like I remember in college, no one was on an IUD. It was like this weird thing that was like on the poster of your doctor's office. It's like, no, it's not even an option. And now I feel like every other woman I meet who's on birth control is on Mirena or Kylena or Skyla or something like that. So very interesting. What I think that they should do is just come up with a male alternative. Like, where is that? It's 2022. Come on, let's do this.
Yeah,
Uh,
just I
so
agree.
like, look, come on.
I will sign the petition for that whenever you come up
I
with
will back it.
that. Yeah.
Back it.
I
So,
just remember, it's funny, this girl in college, she was the only person I had ever heard of on an IUD, and she described it to me. We were in chemistry lab and I remember her walking me through the process, and she's like, "Yeah, I passed out, and my dad's a doctor, so he recommended." I'm like, "That sounds horrible. I'm going to stick with my, NuvaRing, whatever at the time." So
Mhm.
I just remember I was like, I can imagine that stories like that didn't exactly encourage people, but I would
Right.
imagine that a lot of the push now towards the IUDs is this information that we now have gathered on, the negative role that, these hormones can play in the gut microbiome and depletion of certain vitamins and minerals and just the way
Right.
people feel, people reporting low libido and, more anxiety, things like that. So, be
Absolutely.
curious, but male birth control sounds great. I love the idea of that.
Yeah, me too.
That's awesome.
Yes. Yeah.
Um, so what else does PCOS impact other than fertility? Like what are some of the other, because I feel like people don't typically talk about that. They focus just on the kind of gynecological aspect of it.
Right. Gosh, there's a lot. So we have data on women with PCOS having higher levels of inflammatory markers in their blood. And that can kind of, there's obviously we've learned a lot about this recently, not recently, but semi-recently with inflammation and like inflammation's connection to everything in the body as far as disease and health issues. So there's a lot of that. There's a lot of, complexities there, but another thing that I find really interesting is that research shows that women with PCOS have about 3 times higher risk of anxiety and depression.
Mm,
And just kind of working in this field for years and years, almost every and I don't take one-on-one clients anymore, but almost every single woman that I would take as a one-on-one client in recent years had anxiety, depression, or both. And after a while, I was like, gosh, is it just everyone out there anxious and depressed, or is it PCOS? And kind of so that statistic really hit home for me working in the field, and it does make sense. If we're not ovulating, our hormones are imbalanced, and hormones can so greatly impact our mood. And we know estrogen can be a little bit anxiety inducing, and when we're not producing progesterone to balance it out, we see this kind of anxious state all the time. Progesterone is kind of our calm, chill, I want to hang out in my sweatpants and watch Netflix, on the couch kind of hormone. And when we're not producing that, we've just got this unopposed estrogen, which has all kinds of potential implications in the body, but the tie to mood is huge. So I see that a lot, and I don't think we talk enough about that. Some other issues with PCOS, fatigue and cravings, huge, because with PCOS, we've got this insulin issue. And I mean, we see women just with crippling fatigue and they can't understand what's going on, how to fix it. And then, of course, that doesn't pave the way for healthy habits. If they're wanting to start a new exercise routine, but they're like crawling on the floor by 3 p.m., that's not, going to lend itself to helping them with their goals. And then the cravings is huge, imbalanced blood sugar and insulin resistance, all this stuff can really make those carb sugar cravings really intense, and that messes with your mind. A lot of women are just so frustrated with that because they're like, no, like, I'm smart, I have willpower, but these cravings are so intense and they just like can take over. And then again, they're not aiding them in their health goals. If they're working on weight loss, which is already difficult with all the hormonal issues, then that just kind of compounds the problem. And we also see issues with cortisol, higher levels of cortisol, which is cortisol is our stress hormone. So this whole adrenal component to PCOS is huge, and this kind of inability to deal with stressors and the physical manifestations of stress can just be really intense,
mhm.
especially if you have more adrenal based PCOS, where maybe you don't have the weight issue or you don't have the insulin issue, but this adrenal piece can be so huge, and really detrimental. So those are a few things that PCOS can kind of influence and impact negatively that we don't always talk about, in the doctor's office.
I think that's really important that you brought up the mental health aspect of it as well, right? Because that's a tough one. I mean, anyone with any sort of chronic disease or health condition, it can be very challenging navigating that and feeling like yourself and, going about your daily life in a really positive manner when you're physically not yourself. It's tough.
Right. I know. So true. Yeah. It's tough.
So, in terms of supplementation, you've got a fantastic line of supplements, many of which I am very familiar with. Magnesium, probably one of my favorite minerals.
Nice.
But can you share, you've clearly done extensive research in this area. What are some of your favorite supplements that you think are like the biggest bang for your buck for PCOS, and maybe kind of why? Like, what do they actually do?
Sure. Yeah. So from my line, the androgen blocker and the cortisol calmer are the most popular ones for a good reason. The androgen blocker helps to encourage lower levels of testosterone and other androgens like DHT and DHEA, which can cause what we call hirsutism, which is facial and body hair growth in women. That's a really frustrating symptom because it's so physical. And, women are so self-conscious of that, obviously. So that's a huge one. We've seen a lot of success with the androgen blocker there, also in acne and androgen related hair loss. So if someone with PCOS has ever had elevated testosterone or any of those male sex hormones, the androgen blocker can be a really amazing supplement because it doesn't have side effects like metformin or, spironolactone, which is what a lot of us are given prescription wise. So that's a great one. And then the cortisol calmer is a really great one for stress. And, I always say, that you can't out supplement a stressful lifestyle, but the cortisol calmer is super soothing and it gets you to sleep and it helps you stay asleep. That alone is huge because if you are dealing with these stress issues and you're not sleeping, you're already having fatigue from your blood sugar problems. The cortisol calmer can be just a really excellent addition to your bedtime routine, and a lot of women love it. It's also helpful just kind of for increasing resiliency for stress and tolerance to overwhelm, and that can always be helpful for everyone. So those are my two most popular. The magnesium also great for mood, insulin, sleep, digestion, all of the above. The supplement that I also really like that I don't manufacture is called Ovasitol. And I have another highlight on my Instagram called Ovasitol. But that one is basically a blend of two different inositols. And that is a vitamin-like substance that's really helpful for balancing blood sugar. It's also great for egg quality. So it's a good one for men and women who are trying to conceive. So it's a wonderful supplement as well.
Awesome. Great. Yeah, your cortisol one it's got ashwagandha and rhodiola. Those are two of my absolute favorite adaptogens. I'm a huge fan. I actually use those on a daily basis. So really, really like this.
Yes, yeah. And women without PCOS can use the cortisol calmer.
Yeah.
It's honestly helpful for anybody, but we just know that a lot of women with PCOS struggle with those issues. So that's why it's kind of geared towards them, but anybody can take the cortisol calmer.
That's great. So tell me, this is a common question, and I know it's probably pretty nuanced, but are there certain foods that should be avoided with PCOS? I know there's a lot
Mhm.
of, fear mongering on social media about, you shouldn't have this, you should cut out gluten or dairy. What has your experience been? I mean, especially when you were doing one-on-one coaching, you can speak to the research. That would be great too. But also, like from your own experience, maybe even personally, were there any foods that you found were, I don't know, maybe there was a trend that either exacerbated someone's symptoms or vice versa?
Yeah, that's a great question. And yeah, lots of misinformation out there on the good old World Wide Web and social media. I think the biggest one that we hear with PCOS is gluten and dairy, and we have to eliminate those to treat our PCOS effectively. In reality, we have zero research studies that state it's beneficial to take those out of your diet when you have PCOS. So I think why that's such a quick kind of bandwagon to hop on is because it's a very like just simple thing, right? Take this out and you're going to be good to go, which, as we know, health, nutrition, and PCOS is entirely more complex than that. But I think the number one thing that I see when women do eliminate gluten and dairy is there's a couple reasons why I think it's most helpful. Is because gluten and dairy, at least here in the US, is in like everything. If you go
Hmm.
out to eat, you really have to try hard to find a dish that doesn't have gluten and dairy. And it's probably a salad, and you're going to have to eat it without the cheese or the creamy dressing. So you're left with like this very low carbohydrate meal. if you take gluten and dairy out of your diet in your own home, you're really paying attention to being conscious of what you're eating, right? You're for the first time, maybe you're looking at the nutrition facts or the ingredients. That is more helpful than anything because all of a sudden you are being conscious of your intake. And
Mm-hmm.
maybe previously you didn't care or you didn't know how to care. So, or that you should care is what I meant. So, so that can be one reason why it's so helpful to take those out, but you don't need to eliminate them to see success with PCOS at all. And, there's really no one food to avoid with PCOS. It's really about how much and when. So
Yeah.
you want to be focusing more on protein and fiber and fats and less on carbs. But would I recommend completely eliminating carbohydrates? No, that's really hard to do. It's very restrictive. And PCOS, there's no cure. You have it forever. So you need to find something that's going to work for you for the long run. And so, elimination diets and taking all these things out, this and that, and soy and sugar, it's never going to be helpful long term.
Mm-hmm.
So you can absolutely get 100% control of your PCOS while still eating the foods that you love, but working with somebody to help you modify how your plates and your meals and your snacks really look. Like what's the proportion of those foods?
Excellent.
So the only thing I will say is with dairy, that's the only one we have research on when it comes to acne. Dairy can potentially exacerbate acne. So it doesn't cause acne, but if you are someone who already struggles with acne, you could try taking dairy out and that may be helpful for you.
Mm-hmm.
But other than that, we have no research. And, it's most of the time when women take those out, they see success because their options become very limited and they're being more conscious of what they're eating and ingredients and labels and macros and all that good stuff. So yeah, there's no one food to avoid. You can really eat anything, but yeah, focusing on protein, fiber, and fat and paring down the number of carbs that you're eating throughout the day, at a given meal can be really, really helpful.
Sure. And don't know if you can answer this either, but thoughts on intermittent fasting for PCOS? Would you say yay or nay?
Nay. So intermittent fasting, the majority of research studies that we have on it are done on men, have been done on men, and women are not small men. And PCOS, women who have PCOS are very different than women who don't. So we don't have a ton of research demonstrating its effectiveness. And actually, from a blood sugar balance standpoint, which is really where we're working from when it comes to nutrition and PCOS, we're always focused on that, whether or not somebody has, air quotes, classically defined insulin resistance. So blood sugar balance is huge, and we really aim to keep blood sugar balanced really steady Eddie throughout the day. We don't want to avoid food for a really long time, have our blood sugar dip, and then we eat this gigantic meal and our blood sugar and our insulin skyrockets, and we've got these big peaks and valleys. We want to keep it really stable. So I recommend 3 meals a day and 2 protein-rich snacks per day, generally. That's just a general guideline. But the other thing about intermittent fasting is, again, we have to find something that's going to work for us long term. And it's really hard it's restrictive. It's hard to carry that out for years and years and years. And we really have to, put the joy back into eating because there's so much fear when it comes to food and PCOS. So, yeah, I'm not a huge fan of that for those reasons.
Excellent. Well, thank you
Yeah,
for walking through that. That's really helpful.
totally.
How about physical activity? Is there like a type of physical activity that's maybe better or worse for PCOS?
Mm-hmm. Yeah, so I recommend a variety. I recommend some cardio, some strength training or resistance exercises, and what I call restorative workouts. So those are things like yoga, walking, slow biking, hiking, these things that are going to be really great for stress and adrenals and mood. So kind of a mix of all 3 of those. And exercise and movement is so, so, so important. It's important for stress reduction, mood, obviously, like I just mentioned, but also for blood sugar control. And, a lot of us live such sedentary lives, especially since COVID and working from home. So if you don't, you don't have to be an Olympic athlete to help your PCOS, simply just doing a little bit of movement a few times a week can be so much more helpful than not doing anything at all. So yeah, there's kind of like with food, there's no one exercise to completely avoid. However, everything in moderation. If you're doing CrossFit, would I recommend CrossFit 7 days a week? No, I've actually seen that backfire in clients. But if you want to do a CrossFit or maybe a HIIT class once or twice a week, great. But balance it out with some other things, like some, one of those restorative workouts.
Mm-hmm. Yeah,
Yeah,
and proper fueling too, which you already mentioned is, key for physical activity. So if you're not properly fueling, physical activity is, something that you can't really even prioritize if you're not fueling for it.
so true.
Getting a dog definitely could help you if you're
There you
listening
go.
and you've been thinking about getting a dog. I got a dog and it's like, when she's a puppy, we're going out 3 times a day. And I was like,
Right?
I was going out anyway, but now I have more of an excuse and it's more fun. So, and I saw you on Instagram the other day. You were on the elliptical, I think, with the baby, taking momming to a new level, I think is what it
Right? Yeah, don't get a baby if you want to be outside exercising because it backfires also. I miss
said.
that all the time. No. Yeah, you got to make it work. Do the
Yeah.
best you can.
Exactly. I love
Yeah.
that.
Yes.
Is there anything else that you would add? Like, is there any part of your own PCOS story that you would like to share that you feel like would like maybe something you wish you would have known? I mean, you've gone through a successful pregnancy and have, a healthy child now. Is there anything that you feel like you would like to share with the listeners?
Yeah, I think just, the reason why I got into this field is because I, like, myself and also so many women with PCOS have experienced is just this kind of frustration in the healthcare community, unfortunately. We just don't know enough about PCOS and we're not educated on it. And so when we go and seek treatment, I mean, we're having these symptoms like, really random periods all over the place, which makes our mood everywhere all over the place. Or we can't get pregnant, or we're growing a mustache. These are really tough things to deal with. And when we go to the doctor, we're just given the birth control pill or whatever birth control form as a treatment, or we're told to just lose weight, but we're not given any guidance on how to do that, or we're told to just come back when we want to get pregnant, which is not good enough for us. And I'm speaking for all women with PCOS. That's why, I got into this field to also be an advocate for women with PCOS because it's not enough and we deserve better care. Not all of us want to take birth control. It can be really helpful for some. And I'm definitely in no way anti-birth control. Like, it's a great option for some women, but my goal is to help women become aware that it's not the only option, right? There are other things we can do to help with our hormones, to help with our with pregnancy prevention. We talked about cycle tracking. There's a whole world of that, and just to give more options to women and help them feel less alone and less lost, I guess, because it's a big world with all this swirling info. Some of it's totally BS. I see so many. When I first got into this field, there were maybe like one or two, maybe three PCOS Instagram accounts. Now there's hundreds, and a lot of them are run by people who have no credentials, no license, no education. They just decided to be PCOS experts. And it's like, wait a minute. And they could potentially give really detrimental and harmful information. So I also want to be a source of, evidence-based information when it comes to PCOS and how to get control of your symptoms. There's also a lot of, with the whole weight issue with PCOS, it's a lot harder for us to lose weight and maintain the weight loss that we've had. And there's so much that can fuel eating disorders and, restriction and elimination. And then we get to binging and all this ugly stuff. And stepping into kind of the weight management space, I really wanted to be someone who could say, yes, you can work on weight management, but you don't have to hate your body to do it. And you can also do it in a way that actually feels good and is sustainable. And it's something that you can feel good about, and you don't have to beat yourself up when you fall off the wagon and then you regain it all back. And, that vicious cycle that I see. So I guess, yeah, just in summary, anyone listening who has PCOS, you're totally not alone. And, even me who works in healthcare has been in that same position of, I have PCOS, what do I do about it? And then feeling really frustrated by the lack of care that I've received in the doctor's office. So, and it's not always a doctor's fault. They're busy, they've got huge long line schedules, and they can only do so much. So, it's nice to be able to kind of fill that void as a dietitian to kind of bridge the gap between PCOS care and nutrition, because the connection is so critical.
Mm-hmm. Excellent. Well, thank you for that. And I'm sure a lot of
Yeah.
people will appreciate that. And you have such great content on your Instagram account, which I think is very refreshing. And that's one of the things I initially noticed about your page was that, you were sharing recipes that were simple and easy, but evidence-based, but also not restrictive. And I think to your point, yeah, there's a lot of people out there who are sharing things that could be harmful. So I think that's just really good to keep in mind for all
Yes,
of us.
definitely. Yes,
Excellent.
totally. Yep.
So you don't take one-on-one clients anymore, but you do have, I think is it a group course that you have?
So I have two programs that are
Okay.
kind of group based, but they're basically DIY, like go at your, not DIY, go at your own pace. So you don't have to join and then, do everything at a certain time, week by week. It's really go at your own pace. But you do have access to me directly in this private membership community. So, you can pick my brain on anything, ask me any question, and I'm guaranteed, to give you my time and my response. We do lives within the program. And I have two. I have Get Pregnant with PCOS, which is focused on PCOS symptom mastery and fertility and pregnancy. So many babies from that program. I'm super proud of that program, which is why I keep running it. And then I have my PCOS Boss Academy, which is all about PCOS symptom mastery, but permanent non-restrictive weight loss as well. So the kind of the no talk of fertility there. It's all kind of weight management in a way that's doable, maintainable, and doesn't feel like you're on an elimination diet. None of that.
That's awesome.
So I run those two programs, and they're reopening on August 31st, but I typically run them a few times a year.
Okay, excellent. So the womansdietitian.com
Yes, that's
and
right.
her Instagram handle is the Woman's Dietitian. So everyone go follow Corey. She's got some amazing advice, recipes. Her energy is awesome. And, now she's got a cute little baby here that I'm sure we'll be hearing some more about, kind of some things that we could all do to support, fertility and a healthier lifestyle. So.
Mm-hmm. Yes, thank you so much. I appreciate
Yeah,
it.
of course, Corey. Thank you so much for coming on today. It was incredibly insightful, and I really
Yeah,
appreciate you sharing your expertise.
absolutely. Anytime I could talk for like 9 years about PCOS. Also,
I know the feeling.
oh,
It's a good feeling.
yeah, exactly.
All right. Well, have a great rest of your day.
All right, you too. Thank
All
you.
right. Bye.